artery. Vessels SA node is supplied by right coronary artery. SA node is supplied by right coronary artery. Question number 63. In MRI of the heart in hypertrophic cardiomyopathy, muscle mass is best assessed by using a steady state precession sequence in which plane? Left ventricle, short axis, oblique. In MRI of the heart in hypertrophic cardiomyopathy, muscle mass is best assessed by using a steady state precession sequence in which plane? Left ventricle, short axis, oblique. Muscle mass in cardiomyopathy is assessed by using a left ventricular short axis oblique view sequence. Question 64. Which word suggests occlusion of the right brachiocephalic vein? Continuous monophasic flow in the right subclavian artery. Now, when there's monophasic flow, then it means there's some obstruction. In monophasic flow, there will be something like on top of our sound, the normal flow, the systole, and there is diastole. But in monophasic flow, there will be only systole and no diastole, only systole. So there is no diastole, so it means there's some obstruction. So when there's occlusion of right brachiocephalic vein, there will be continuous monophasic flow in the right subclavian vein. Question 65. Female with stridor chest radiograph shows superior mediastinal mass with narrowing of the trachea and displacement to the right. Focal classification, diagnosis, thyroid goiter. Here is now a clinical scenario of retrosternal goiter. Chest radiograph shows superior mediastinal mass with narrowing of the trachea and displacement to the right. Focal classification is also seen, diagnosis, thyroid goiter. Goiter can also have focal calcification. So superior mediastinal mass with narrowing of trachea and displacement to the right, and also female with stridor, diagnosis, thyroid goiter. Question number 66. Chest radiograph and CT shows 2 cm rounded mass in the apex of the left lung not amenable to biopsy. Which technique may help to improve characterization of the lesion as benign or malignant using SUV, standard aptitude. Dual time point assessment of SUV. Remember that SUV greater than 4 also detects malignancy, and to help improve characterization of lesion as uh, benign or malignant using the SUV, we use a dual time point assessment of SUV. Again, which technique may help to improve characterization of the lesion as benign or malignant using standardized uptake value, dual time point assessment of SUV. Question number 6. CT scan shows a 4 cm rounded lobule mass arising from the mediastinum adjacent to the right side of the carina. The attenuation value of the lesion is 10 HU, diagnosed bronchogenic cyst. Now, CT scan shows a 4 cm rounded lobule mass arising from the mediastinum adjacent to the right side of the carina. Attenuation value is 10 HU, diagnosed bronchogenic cyst. The selected image from CT scan, okay. Again, there's a retrocardiac structure causing spinning of the carina and rounded lesion in radicardic region causing spinning of the carina and mild compression on the right main bronchus, diagnosed bronchogenic cyst. The anterior mediastinal mass and posterior mediastinal mass and middle mediastinal mass, we have to revise these. Anterior are 5 T's, thymoma, thyroid, teratoma, and teratolymphoma. Middle mediastinal are bronchogenic cyst, lymphoma, and important is posterior mediastinal have neurogenic tumor, most likely neurogenic tumor, and then esophageal tumor and aneurysm. Question number 68. 16-year-old male chest radiograph has multiple bilateral nodules measuring up to 3 cm, some of which are calcified. Patient has been undergoing treatment for a malignant tumor, diagnosed metastatic secondary osteosarcoma. Now, 16-year-old male child chest radiograph has multiple bilateral nodules measuring up to 3 cm, some of which are calcified. Diagnosed metastatic secondary osteosarcoma. Chest radiograph shows multiple bilateral nodules measuring up to 3 cm, some of which are calcified. Diagnosed metastatic secondary to osteosarcoma. This is also osteosarcoma on CT scan. Multiple rounded nodules, some of which are calcified throughout both sides of the lungs. Diagnosis: metastatic secondary to osteosarcoma. Question number 69. CT scan of the chest shows beaded thickening of the interlobal receptor as also noted. Diagnosis: demyelinated cardiomyopathy. Now, on chest radiograph, there is beaded thickening of the chest radiograph. There is period thickening of the interlobal septa noted, diagnosed dermatitis cardiomatosis. On chest radiograph, there is period thickening of the interlobal septa, diagnosed dermatitis cardiomatosis. On CT scan, there is period thickening of the period thickening of the interlobal fissures, interlobal septa, diagnosis dermatitis cardiomatosis. The differentiating point between lymphangiomatosis, uh, Langerhans cell histiocytosis, and LIP. Question 70. Chest radiographs show normal volumes. HRCT shows multiple thin-walled cysts with central lobal nodule of 0 to 10 mm throughout the lung. The inferior lung is normal. Diagnosed histiocytosis. In histiocytosis, the intervening lung is normal. So HRCT shows multiple thin-walled cysts with central lobal nodules 3 mm throughout both lungs. The intervening lung is normal. Diagnosed Langerhans cell histiocytosis. And intervening link is abnormal in LIP. Number 71. A patient undergoing lung resection for malignancy, which imaging investigation is the best predictor of post-operative lung function when there is scintigraphy? Now, in patient undergoing lung resection for malignancy, which imaging investigation is the best predictor for post-operative lung function when there is scintigraphy? Okay. Scintigraphy is also important in stress factor, but in lung ventilation scintigraphy is best for predictor for post-operative lung function. 72, a 42-year-old man suffers a chest injury in a traffic accident. The presenting chest radiograph shows fractures of the fifth and sixth ribs on the right side with patchy air phase changes. A repeat chest radiograph shows the consolidation to have largely resolved, but around opacity is not present with air fluid level. That means pulmonary laceration. Pulmonary laceration. Lymphoma 73. Important thing is what is pulmonary laceration? After trauma, then there will be round opacity with an air fluid level after trauma. After trauma, there will be a consolidation in the lung, and then round opacity with air fluid level. After that, will be diagnosed pulmonary laceration. Okay, so considering largely resolved, but round opacity is now present with air fluid level. Diagnosed pulmonary laceration. Okay, question 73. Question number 73. 1 year post heart transplantation, follow up chest radiograph. This showed multiple nodules of varying size with enlarged highland lymph node. Diagnosed post transplantation lymphoproliferative disorder. The hint is that post heart transplant, there will be multiple nodules of varying size with enlarged highland lymph node.